Hi there. I just would like to take a couple of minutes to talk about last night's TV programme with Julia Bradbury in the UK and talking about her breast cancer journey. Um, what I thought was that not everyone can be so honest and emotionally open as Julia was. Those of us who've been through breast cancer know that there are many facets to this disease, and clearly there wouldn't have been enough time to include everything. What Julia has done is highlight the devastating effects of breast cancer. Whatever diagnosis and treatment people go through, there's still room for more information. But it would be too overwhelming for people to see it on a TV program, and besides which, it wouldn't fit into an hour. So maybe a series showing the journey of some willing breast cancer survivors would work. Maybe somebody in TV could do that. Although TV personalities do actually draw in the crowds, so as more people get to see it. Julia was actually very frank about how she felt from the moment she noticed her lump, and she even went so far as to show us her, as she phrased it, small but perfect boobs. So we knew how she would look before and afterwards. Um, that was an amazingly brave thing to do. There's no way I would have done that on camera. But, she wanted to tell people just what it's like. What actually resonated with me was the fact that she immediately thought of her family, her children in particular. And she said that there was no way she was going to leave them. And yeah, I get that. I get that. I think most of us who have children say the same thing. When women and men, of course, are diagnosed with breast cancer, their first thought is normally for other people, because as far as their treatment is concerned, or their breast cancer, they've got no choice. They've just got to get on with it and have the surgery, have the treatment. And it's other people that we worry about, so we tend to not let our feelings out too much. So I would say, yes, you're very scared at the outcome because you don't know what's going to happen, and cancer has always been a word that's put the fear of God into everybody. But you're also terrified of the effect it'll have on the rest of your life and the people in your life. Another thing that Julia did was she said goodbye to her boobs the night before the surgery, and that's something that I actually did. I remember standing in the bathroom saying goodbye to it. She had actually prepared her children, so they knew that mummy was going into hospital and that she would be back for cuddles. And her children were quite young, so obviously she wants to see them grow up. So that was quite hard for her to do, and talk about what the children said to her. And it's difficult to keep that smile on your face all the time. When you're going through something so new and scary as a cancer diagnosis. But she did actually manage to let those feelings out on TV. I have to admit that I didn't get upset. And I think when I was diagnosed, and I think possibly that's because I knew that once the floodgates were open, that I perhaps wouldn't be able to shut them again. But I would say that, if anybody wants to have a really good cry, then do it. Get it out of your system and then get on with it. A lot of people talk about how brave we are, but actually there's nothing brave about it. We just don't have the choice. We've just got to get on with it. So Julia was offered an immediate reconstruction, which looked really good after surgery. She had an implant put in, and she was shown that before surgery. Not everybody's offered this. It depends on, what your surgery is and, whether you've got to have chemo, radiotherapy, that kind of thing. So chemo and radiotherapy weren't actually mentioned, but maybe that's for somebody else to discuss. There's only so much you can say in a program without people getting absolutely overwhelmed and distraught. And unless you've actually been there yourself, it is hard to take in. And it's amazing how we all suddenly become experts in the terminology and the treatments for breast cancer, something that we never imagined we'd ever have to learn about. So anyway, what I'd like to say is that if you've been through breast cancer and you're struggling with some aspects of your life as a survivor, then I'd say get in touch, and I'll give you some tips on anything really, because it affects all parts of your life. So I would say anything from work and relationships to fatigue and body image. This consultation will be free, of course, and you leave with feeling a lot more positive, with a few ideas and an idea of which direction you'd like to go in. So get in touch, put something in the comments, and I'll get back to you as soon as I can. Okay. If you haven't seen the program, try and watch it. Okay. Bye for now. Bye bye.